I am Dr. Chris Aboje, an EAP expert and a clinical psychologist. This month, September, is reserved for the word suicide prevention awareness, which is a reminder that every life matters and that together we can help prevent suicide. Now, suicidal thoughts don't always mean that someone wants to die. They, in fact, often are a signal that the person feels trapped, hopeless, or overwhelmed and doesn't see a way out. Now, contrary to what many cultures believe, that when people think about dying, they are wicked or they are cowards. In fact, it's a sign that this person is overwhelmed and they're looking for a way out. And so these are some of the warning signs that we can look out for. One, an individual who is talking about wanting to die or feeling like a burden. Or somebody who is withdrawing from friends, from family, or from work. And in some cases, sudden changes in mood or behavior, like increased sadness, irritability, or a calmness, an odd calmness after deep despair or grief. And in other cases, risky behaviors, including drinking while driving, or even giving away belongings or saying goodbyes, could be signs or warning signs of suicidal thoughts. Now, what do we do? The first thing I always would say is that we need to learn how to notice people around us. There's a common saying or popular saying that when I is replaced with we, even illness can become wellness. And I think that's the mindset that we should take towards supporting the loved ones around us. Learn to notice. Now, if you see changes, don't just ignore them. A simple question like, I have noticed you seem down. Do you want to talk? Can open doors for more intense or intimate conversations. Now, listen without judgment. Let them share. You don't have to always have the answers. You just need to be present and let them know that someone is there and someone cares about them. Encourage them to seek support. Now, suggest to them that they can seek professional help, like talking to a counselor or even reaching out to the EAP or the doctor. You can even offer to take them or even help them set up these appointments. But most importantly, you need to stay connected. You need to let them know that you care about them, follow up, check in, and remind them that they are not alone. Remember, asking someone if they are thinking about suicide does not put the idea in their head. It even shows that you care. Now, suicide is preventable, and together, by watching out for one another and speaking with kindness and courage, we can actually save lives. Now, thank you for taking these few minutes to reflect. And please, if you or someone you know is struggling, reach out. It is okay not to be okay, but most importantly, we need to learn to ask for help, right? Because help is always available. And like I said earlier, when I is replaced with we, even illness can become wellness.